Because you're just dropping gems right there, and I don't think I can write everything down.
And I do ramble and talk fast. So I'm
No, no,
sorry.
not at all. I love it. I love it. Okay, so that was awesome. So, what specific mental skill or areas do you commonly address with athletes? Like, is it like the goal setting? Is it the concentration? Is it just the confidence and just letting everything go?
Yeah, I mean, it's definitely a mix.
Mhm,
But I do see a lot with performance anxiety and coping under pressure.
mhm,
Um, and what I find is, or what I try to explain, is that how you're responding in a competition or a game setting, like having them understand their physiological response, their psychological response, and even their behavioral changes in those moments.
mhm.
Um, I have them kind of connect it into other areas of their life, like school, work, relationships, because
Yeah.
your body's the same, you know. So if we can begin to identify the triggers,
Mhm,
right, then start to implement these coping mechanisms, whether it be in sports, in school, or in personal life. So
okay.
a lot of performance anxiety and coping under stress. Definitely confidence. That's a big area.
Mhm,
And then goal setting, I use a lot when working with teams, especially in their off season,
mhm.
to have be working on, identifying their long-term goal, but also what are the short-term goals they want to achieve, and then what are the daily action steps and
Okay.
all of that, like the athlete mindset action plan. Like, so
Yeah.
they're thinking about all these different pieces and components of what they need to be working on.
Okay, awesome. So how do you help athletes like make decisions or like manage their pressure from like performance anxiety? Like,
So definitely different for each athlete. I mean, it's not a one size fits all, but I usually start with having them explain the situations or explain when they notice that they're feeling anxious in those moments. Like, how do they know they're feeling anxious?
mhm,
And then breaking it down, as I said before, to them thinking about the psychological responses. Like, how are they, like, what's the interpersonal communication? How are they speaking to themselves? What are their self talk patterns?
mhm,
Um, Getting into the physiological responses,
mhm.
and going into the behavioral changes that they notice during these times. A big piece I do talk about is, when we think about pressure and performance, you need a little bit of pressure in order to perform well. So
Yeah.
not all of this is a bad thing. So
Mhm.
then I usually follow up with, when you're feeling what you just told me, are you performing at the level that you thought you would be performing, or are you not performing well? And if they say, like, yeah, I'm performing well, like I'm doing great, it's just this is what I feel beforehand, then I'm usually like, I think you found your sweet spot. Like, let's not fight it, let's embrace it. But if they say things like, some athletes get very sick before the start of a competition, they're running back and forth to the restroom, or they have a really bad upset stomach,
Mhm.
or whatever that might be, and they'll be like, no, I don't perform well, in those races or during those games. Then we know, like, okay, you're swinging a little high, we need to figure out what to apply coping mechanism wise to help you get into your sweet spot of performance and pressure.
Okay. Yeah. I like that a lot because like you definitely have to find that sweet spot in between like, having like positive pressure and then negative pressure where like it's kind of taxing you or positive pressure to kind of push you. So I like that a lot. Um, so when an athlete gets injured, we typically think of an injury as like a negative kind of like event in our life. How do you manage to kind of help that patient shift more so like their perspective from, oh, this is a negative event that happened into this could be a positive. This could be like something that happened because we need this to maybe perform better in the future. Do you know what I'm saying?
Yeah, yeah, and I think the biggest piece there is the athlete learning to accept that they got injured.
Mm,
And that's that sense of, being mindful and being present. And a lot of times, having had previous injuries, or, just when you go through or meet athletes with injuries, a lot of times they might be resistant to it, like trying to fight the fact that they got injured, or, oh, I'm supposed to rest, but, I can use my upper body, so I'm going to go do this at the gym instead, and kind of combating what they're prescribed with their protocol, and it's not helping them out. So I think helping them learn to accept that the injury occurred is very important, and they're all going to do that on their own time. I mean, right, the
Yeah.
responses are totally unique for every single athlete, and the emotional response, the psychological response, and the toll it plays on the athlete is huge.
Yeah.
But not uniform, so we can't make assumptions either. But I think acceptance is the largest part, and then working with them to understand, what's prescribed by the PTs or ATs as to their protocol and their expected return,
Mhm.
but implementing the psychological piece throughout that process instead of waiting until, they're 4 weeks in, 6 weeks in, or they've been released back and they feel they're psychologically not ready to return.
Mm.
So, it's so interesting. We get physically cleared to return, right? And we go through all that protocol, but psychologically, we don't really assess the psychological readiness to return to sport, even though the assessments exist.
Yeah.
Um, that's looking into their confidence. That's looking
Yeah.
into their and their fears of
Yeah.
return.
That's a really good point. So, what outcome measures or what kind of like tests do you do to kind of make sure that they're psychologically ready to return to sport? Because yes, physically, from a clinical standpoint, like physically they're able to go back to what they want to do, but mentally they still have that little bit of percentage that's like inhibiting them to fully return. So,
Yeah.
what tools do you use to kind of help them go back?
Yeah. So, I mean, one of the tools is simply talking with them, and this is something too, like we can't expect to throw this on the PT and AT's plate. I mean, it's not their, I don't want to say it's not their wheelhouse, but it's not their responsibility to be all of a sudden a psychologist too, even though informally you guys probably are, but chatting, how are you feeling? Are you ready to return? What hesitations do you have? And kind of normalizing that discussion, because the athlete could be feeling that there's something wrong with them, that they're fearful to return, or
Mhm.
that they don't feel that they're going to return as strong. Um, on my end, there's tons of assessments, like in the psychology world, there's tons of assessments. And one I have used more for research, I'm drawing a very large blank right now, but I think it's called the Injury Readiness Return to Sport Protocol. I think that's what it's called. And it's a very quick questionnaire. It's like 6 questions,
Mhm.
and they rank their confidence to return.
Mhm.
And it's maybe less than a minute for them to complete. You score it, and then you get a level of what's their confidence to get back into the competitive environment.
Okay.
So we can also use the assessment piece too.
Okay. I like that. So the assessment piece is very important, but what's your communication style with them to kind of gain rapport and just kind of be able to, you know, establish like a good, common ground between you and the athlete? Because most of the time they're so, in their head about like, oh, this injury is gonna like, I'm not gonna be able to do this, I'm not gonna be able to do that. So like, how do you find like a common ground between you and the athlete?
So definitely the trust and rapport is very important. And that's where it depends on how integrated you are within the system. So for instance, I usually will get referrals from our AT at Rowan if an athlete is really struggling, like, hey, do you have some time to speak with so and so this week? Really having some challenges, blah, 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 blah. And then I'll meet with them. Now, because I'm on campus, they know who I am, but I don't have relationships with every single student athlete. So that is definitely a struggle because I'm not with them from day one of their injury
Mhm.
until they're really.
Mhm.
Um, some organizations will have a sports psychologist on staff where they're embedded within the program, and they might have more access to be with that athlete from day one of their injury to when they're released. So it depends on, the organizational structure. But yeah, the trust and rapport is really important to establish. And also, I just think the concept of just being like empathetic with them,
Mhm.
where you're not trying to make them feel bad for how they're feeling,
Yeah.
but they very nervous to disclose and to talk about, you know, what they're truly experiencing, or the thoughts that they've been having, or the hesitations that they've been, thinking about. I think it's also very important to express confidentiality with them, that what they talk about when they're with me is just between the two of us. I'm not going to run back to coach. I'm not going to
Yeah.
run back to T or the PT and talk about what we just discussed.
Yeah.
Like, I won't breach that confidentiality. If they want to breach it, they may, but I'm not going to do that. And sometimes they don't realize that it's a confidential conversation.
Mm.
So they could feel more comfortable starting that process. But really, I think the earlier you can get in there in a proactive way, in a sense, the better.
Beautiful. You just mentioned like a really good part where they're worried about the confidentiality of it. Like they're worried if I share this information with you, you might go and tell someone that, this is what I said. So that's a
Yes.
really good point, actually. And that kind of like helps kind of just make them at ease when they talk to you and help you find like, good common ground with them. That's a good point. I like that.
Thank you.
Yeah. So, okay. So what methods do you use to like monitor and evaluate progress over time? Because like they come in, they tell you I have this issue, you try to work on it. What methods do you kind of typically use to kind of just help make sure that you're even, in your professional aspect, like you're making progress with them too, even if it's not showing in their mind, it's still showing objectively.
Yeah. This is challenging.
Yeah.
I think the reason why it's challenging is because of compliance and adherence to showing up to sessions and pieces like that. So some athletes are more likely to schedule, weekly sessions or every other week, or at least pop in once a month. Some are not. And
Mhm.
it's hard to get them back. Some still have a very large, like they'll show up to the meeting,
Mhm.
because the AT suggested it, or maybe they want to just scope it out, but they still have a stigma associated with what we're talking about, or discussing and closing how they're feeling.
Yeah.
So I think the adherence and compliance is challenging.
Mhm.
On my end, what I always do is I take notes. I mean, most practitioners will take detailed notes so they can debrief the sessions,
Mhm.
so that way, if that athlete met with you and you don't hear from them for a couple months and then they pop back in, at least I can review where we left off
Mhm.
and then try to close the gap on what happened between then and now.
Mhm.
That's a challenge. That's hard. And everybody holds it differently. I hold it as I hold like my sessions as being athlete centered. So I want to be there,
Yeah.
because otherwise it's a dread. They don't know what to talk about. They're sort of just checking a box, and they're not engaged or connected.
Yeah.
And that can be hard, because then are we helping them? I don't know. So that's where I try to allow them to be the leader in deciding what they like. I'm here whenever you need me, but you decide when you need me,
Right.
and we kind of build and work from there.
Very good. Very interesting. I like that a lot. I find it interesting when you find like a person that had a very bad injury, like let's say an ACL injury, and another person has the same injury and everything, but one person's very positive and the other person is very, in their head about it. And just the difference it makes in the session itself. Like for me, in my experience with Trifecta, I see a lot of athletes and I see athletes from like ages of like 16 and over and up. And I noticed that the mental aspect of it, like their ability to kind of just shift their perspective, like, oh, it is what it is. Like it's happened. So I need it. I just need to get it better now. And some people talk about their injury in third person. Like, oh, like my knee's talking to me today, or she's talking to me today, or like she's a little bloated today, something like that. that negative talk influences the session.
Yeah.
And the positive talk where other person is like, oh, like it is what it is. I just need to, just do what you got
Yeah.
to do. I'll do the exercise. I'll feel better afterwards. It is what it is. How do you shift that perspective between, you know, that third person perspective kind of view? Because I'm having issues with this. Athletes come in and they have like a third person perspective on their injury, like, oh, she's talking to me, she's bloated, whatever. How do I shift from that to like, oh no, your knee is part of you. Like you need to just kind of like be able to listen to it, but like don't hyper focus on it. Like, how do I shift from that to just kind of like go into a neutral position, not even just so much positive? Any intake on that?
That's hard.
Yeah.
That's interesting. That's very interesting. But yeah, I mean, the first piece that you said is so true, how it could be the very similar injury, but everyone responds so uniquely to it. So on the psychological side, I would recognize that if someone's speaking in third person, also I would look into like what's their attitude like during the sessions. Are they, I don't want to say smiling, but are they like comfortable? Are they connecting with the therapist? Are
Mhm.
they, like, are they still showing that they are motivated to adhere to the program,
Mhm.
or are they not? Are they disengaged? Are they very negative and down? Are they no real facial expressions, very like apathetic in their look? So
Yeah.
I would examine those pieces too. But the shifting from the negative to the positive, the hard part is that's a choice that the athlete has to make. And this is where, like, you guys as PTs, right? This is where I guess you become the side psychologist, right? During your time there. But exploring, like, talking about things maybe outside of the injury to see how they're doing, like how's work going, how's school going, what are you doing for Thanksgiving, and just seeing like if anything shifts or changes in their mood, or if they're talking and everything's very negative. That's a big, because even with that healing cycle, I mean, I know Jeremy has, if I remember correctly, in his Glassboro office, he has that like that pain center wheel or something like that, where it talks about
Yeah.
all the different aspects, right, of healing and
Yeah.
life stress. So it's not just physical. We have to think about what's going on socially with them. Like, are they withdrawn? Are they isolating from other people? Or do they feel left out? Because the season is moving forward and they're not part of it. Did they miss that marathon they were training for and had dedicated 5 months to,
Mm.
and it's a month away, and they feel everything went to waste and I'll never know if I'll be able to run again? So there could be a lot of other layers in there. On my end, I try to incorporate more of like a mindfulness based stress reduction approach when working with athletes that are more on that negative side, like that negative approach to whether it be injury or just, life or however it might be. And that really is educating them on the first piece, which is self-awareness,
Mm.
and just learning to monitor themselves and think about what are these triggers, like what are the thoughts creeping in, or the situations that you're exposed to where you notice that there's something that all of a sudden like triggers you, and then you respond, or your mood shifts or changes. Because if we don't understand those triggers,
Mhm.
can't navigate and try to figure out why you're really responding in the way that you do. So the self-awareness is key. And then the second piece is the acceptance, as I said before, like
Mm.
being able to accept the fact that this is how you're responding to the fact that you got injured, but to do it non-judgmentally. Like the fact that you got injured doesn't have anything to do with actually your level of performance as an athlete. You got injured. No athlete wakes up that I'm aware of and says, like, today's the day, gonna tear my ACL, can't wait. Like, right, they're unexpected, we don't plan for them.
Mhm.
So it's a shock to the system, and the way that we all just totally unique. But if that athlete, like one athlete I worked with, not at Rowan, at a different institution, had a horrible shoulder not shoulder, elbow injury and needed like immediate surgery. And she was 6 hours from home,
Mm.
going to go home. So she was really just down because she wasn't with her family and she
Yeah.
wanted to be in her bed. But guess what? Classes were still going on.
Mm.
So she was really struggling. She wasn't comfortable in her dorm room. She didn't have the time to go home because it was the end of the semester. And things just piled up until she just was, there was no light at the end of the tunnel for her. She felt very closed in and everything was negative. So
Mm.
just like serving with not having the attachment of the emotions is sometimes important. But when we're in it, it's
Yeah.
hard to do,
Yeah.
like it's hard to separate it.
Yeah. That's very powerful, what you just said there. I do love that a lot. So you mentioned like number one is just being self-aware of what's happening and what happened and what we can control and what we cannot control. That's amazing. And the second part is just self-acceptance. I feel like those two are, I guess, from my point of view, like one of the two main ones to kind of just target in my session as well, from a clinical aspect. Like, I'm helping you fix your knee, but I need you to help, fix your thoughts a little bit.
Yeah.
Those thought viruses that you're having, like, just be aware of those, but then, accept them and then move on.
Yeah,
That's
definitely.
Yeah. So what kind of tools do you use to kind of help them find that headspace? Is it like
Yeah.
meditation? Is it just like sitting down and reflecting? Like
There's
what
a
would I
variety.
use them? Hmm.
Yeah, there's a variety. And one thing I wanted to add in as you were just talking and making good points is that we need to remember that many athletes are very goal driven. They're very goal oriented. So when something's taken away from them, they kind of flounder. And it also depends on their athletic identity too. Like someone with a stronger athletic identity now being injured might really just not know who they are, like, and not know what else in life they enjoy and what they're passionate about. So even thinking about how can you add in, as in the clinical side, like goal setting in sessions could be something for some of these athletes that then they can be like, okay, like now I'm more driven and connected to the process because this is what I want to be working on this week
Hmm.
and next week and whatever. And they're kind of, you're keeping to the protocol, but they're also thinking about like what they want to be achieving.
Hmm.
So that could be something that works with some athletes.
Okay.
One research study we actually did at Rowan a couple years ago was for our injured athlete population. And we figured two things. One is they're already exhausted. Like they already have too many things on their plate. They're not going to go to anything extra. So what can we do while they're in the training room that doesn't require them to do anything or remember to do anything once they leave?
Hmm.
So we actually, through this research program, we purchased each participant a Headspace subscription. And in Headspace, there's a program called Rehab, and it's a 10-session program, and it unlocks after each session. And so it was utilizing meditation, but we would use it with them. They would put their headphones on or their earbuds in during the downtime of their session, like heating, icing, whatever, stimming, something where they could be more relaxed. And they would just pop in 5 to 10 minutes of a session and then move forward. And we did see that overall it decreased depression and anxiety levels with participants in the experimental group versus the control group. So that was something that worked for that population. But it could be anything. So it could be the self-reflection, right? And having them just keep a journal or check in with themselves. Um, it could be meditation that you use. It could be imagery practices and having them visualize themselves coming back strong. It could even be breathing exercises and working on breath work to help them stay, focused and controlled while they're in a session, especially when they feel so much is outside of their control
Hmm.
during an injury. So having them kind of like tap back into their body could be beneficial. The hard part is every modality is not going to click with every person.
Hmm.
So being creative and having them be on board with trying things out and just being open, like, hey, I love the breathing exercises, or no, they were horrible, please don't make me do them again, right? And then you kind of work from there. So it's really letting them have the control over telling you, like, I like this, I don't like this, right? And exploring
Mhm.
what helps. Because for some people, like, meditating can make them more anxious
Mm.
because they're so, how do I quiet myself down for 5 minutes? And it just starts a lot more. So for some, meditation's not an option, right? And we go to a different modality.
Beautiful. Keeping them engaged throughout, you know, the sessions definitely help big time. Yeah. Wow. That's really, really good. So if I'm hearing you correctly, I don't want to put words in your mouth, but the main things to really monitor is self-awareness, making sure that they're, um, accepting where they're at, and then goal setting, making sure that they have, yeah, we have our own goals as professionals, but the athletes have their own goals too moving forward. So they want to keep going forward with where they're at. So accepting where they're at, but moving forward with like goal setting, like having a journal,
Yeah.
self-reflecting, self-imagery, stuff like that.
Yeah.
Um, and just finding what works best for them with them, for them, with their own feedback too, to kind of keep them engaged.
Yeah. Absolutely.
That's absolutely lovely. What you just said, you really just gave me so much information. Thank you so much. I
Sure.
appreciate that. Any big takeaways that we can help as a student physical therapist and as like future, like as like other clinicians, any big takeaways that we can do to kind of help the athlete get comfortable and hopefully gain that edge to go back to playing sports at
Yeah.
full capacity.
Um, I think the biggest piece, and I know you've brought this up already in our conversation, is building that rapport and that trust. So I think that's regardless if it's the clinical side or if it's on the psychological, like wherever it is, but they're very vulnerable when they're going through this. And for some, they are away from their family, or they're away from their normal structure, and they're learning to trust in somebody who's basically brand new. For some, it's their first injury that they've ever had, and they don't know what this process is like.
Mhm.
So recognizing that they're vulnerable in the moments is important, because we may expect them to be like, well, this is the protocol, why are we not moving forward, right? But why are they stuck, at this? They can't progress from here. Like, what is going on? Are they not resting enough, right? Are they not, allowing themselves to heal? Are they doing stuff they shouldn't be doing, right? Or is it something on another level, like on that psychological level, or just the stress? They're stuck in fight mode, and they can't relax. But I think just normalizing the conversations, and yes, they're there for injury rehabilitation, but they're a person,
Mhm.
and just chatting about, again, like, how was your weekend? What'd you do? And having those normal conversations, and even sharing a bit about you with them too,
Yeah,
could help them learn to, let the guard down a little bit, and just over time develop that connection and trust.
beautiful. Okay. I'll definitely start utilizing. I mean, I'm already doing that, but I'll start doing that more. I have a hard time sharing like, about myself too, like anybody. So I feel like that would help them kind of ease their guard down. So, all right.
Right.
All right. Thank you so much.
You're
I
welcome. It was
really
very
appreciate you taking the time. This is a really good talk. I really did it. Like I'm walking away with a lot of gems. So,
good. I'm
and
happy. If you need anything else, just reach out. I'm always around.
thank you so much. And you have a lovely personality and everything too. So thank you so much.
Sure.
Just to make sure you're okay, if I use any kind of snippets of this video, just like a short, 10, 5-second video in like one of my presentations, that's fine with you.
Yeah. Oh, yeah. That's fine. Sure.
Okay, beautiful. And they'll appreciate it too. And I'm sure they're gonna see like, hey, that's JoAnne. So yeah, they love you and they speak
Oh,
very highly of you
for
too.
for trifecta, you're doing this?
I'm doing this for trifecta. Yeah.
Oh,
Yeah.
um,
Yeah.
that's great.
No, yeah. Dr. Justin suggested that I sit down and talk with you.
Oh,
So
good. That's
they
great. So
speak
are you
very highly of you.
this or Cherry Hill office?
Glassboro.
Nice.
Yeah. 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 So again, Thank you so much. I do appreciate you taking the time, and I hope you have a happy Thanksgiving.
You too. Enjoy.
Much and yeah, take care.
All right. Thank you. Bye bye.